Hi guys, welcome back to my channel. So now that you pass your Nclex in the state of New York, what should you do next while you are waiting for your license? If you are interested in this topic, go ahead and watch the video to its entirety because I think I have some tips and tricks that will help you through that process. Also, don't forget to subscribe, like, and comment down in the section below and share the video with someone that you might know that are going through that process themselves as well. Now let's get to the video. Alright, so before I start, I would like to let you guys know I have my notes here. So if you see me looking down, it's because I want to stay on topic and I'm looking down at my notes. So let's get started. Number one thing I would like for you guys to do is to take a deep breath. Take a deep breath. You did it. You graduate from nursing school, you pass your Nclex. Number one thing, the first thing I would like for you to do is take a deep breath. It was a challenging journey. We all been there. Take a deep breath, okay? Multiple deep breaths if you have to. Number two, take a break. Take a break. Don't go ahead and start jumping on the bandwagon and you're about to start applying for a job and stress yourself out. Take a break. Celebrate the fact that you have passed your Nclex. Spend time with your family. Go on vacation. Do something that makes yourself feel better. Get a pedicure for all I know, but take a break. Take a break. It doesn't have to be a long break, but take a couple of days off, take a couple of weeks off. If you was working full-time while studying, maybe take a vacation, take a couple of days vacation, travel, do something to kind of like ease, how would I say that, to kind of like help you come down, right, during that whole process. So take a break. Number three, stay away from nurses that come. Stay away from Pearson because those things gonna take time for your license to post. Okay, I'm talking about to the people that have passed and they have to use the Pearson tricks and to see that if you're passed and you get the good pop-up, yay. But stay away from nurses that come. Stay away from Pearson VUE because that's gonna increase your anxiety. Okay, my advice to you is, wait at least maybe 4 to 5 days, because Pearson doesn't post the result where you have to purchase to see your actual pass, PASS, until 48 hours. So stay away from that. Nurses doesn't post their the license number online until probably like a week, depending on the state where you take it. In my case, I took my exam through the state of New York, so it takes like a week before I was able to see my license on nurses. Stay away from the Board of Nursing for whichever state that you took the Nclex for, because it might take time for your license number to show. Okay, so stay away from those websites for at least a couple of days to a week. Number 4, do send an email to the Board of Nursing to let them know that you did take the test. Maybe that will help speed up the process. In my case, after I took, mind you, I live in Florida, by the way. I live in Florida and I sat for the board for the state of New York. I watch a lot of YouTube videos of people are saying, oh, it's gonna take 6 to 8 weeks for New York to send you your documentations and all those things, or for you to even see your license on the New York Board of Nursing. Be proactive, right? So in my case, what I did, a couple of days after I received my passing score, I make sure I pass. I check on Pearson VUE, I pass. Then I send an email to the Board of Nursing and tell them, hey, it looks like I passed my exam. Can you please send me a letter verification of passing, or please update my license on your website? That way, once I start applying for a job, my employers can see that I passed, right? I send a simple email, very nice, very professional, because I know they have a lot of applications coming in. So be proactive, send an email. Oh, not even a week, a couple of days after I send the email, I did not get a reply back, a reply email, but a couple of days later, I checked nurses and my license number was on there. I'm not sure if the email helped, but do send an email to kind of like get yourself ahead of the group. And don't call, okay? Send an email, don't call. Number 5, update your professional resume. Update your professional resume, guys. Remember, when you are going to apply for nursing, you are now a professional. So make sure your resume is professional. They have a lot of apps, a lot of websites out there that can help you build a resume. If you have to pay someone to proofread your resume, maybe find someone on Fiverr or something like that to help review your resume, do that, because you want your resume to be the best of the best so they can call you for an interview. Okay, so work on your professional resume. If you have your license number, don't forget to add your license number on your resume. Okay, add it, because it will push your resume to the front. If you have any BLS certification or ACLS, any of those things, add them on your resume. Okay, number 6, start looking or researching into what specialization or specialty, you would like to get into. Maybe ICU, maybe med surg. Some of you guys right out of school, you already know, okay, I want to do ICU, I want to do med surg, I want to do oncology. But if you're not sure, you're someone that is not sure what specialty that you want to go into, make sure that's the time now you need to start doing your research before you even start applying. That way you can make sure that that specialty match your personality. I watch a lot of YouTube videos, sometimes based on your personality type, you have specialty that better match your personality. So do some research so that way when you land that job, you land a job into a specialty that you love, right? My advice to you, if you do not already have a specialty in mind, have top 3 specialty that you would love to work in, because the first one you might not be able to get to work in your first specialty. For example, if you want to work in ICU, your first job might not be starting out in an ICU unit. You might start on a med surg floor, or you might start with peds. Have your top 3 specialty and then start applying for a job towards those specialties. Okay, but make sure it's something that you love, something that you want to do, worked in. Also, if you are looking into, how do you say that, if you are looking into residency programs, start applying into those residency programs. Okay, some of those residency programs, you do not need to have your license number yet to apply for them. So the minute that you find out your pass, start applying into those residency program. That way you can start getting your application out there. Some of the residency program that I apply into, I didn't need to have my license, but for the most of the residency program are usually 18 to 22 weeks or something like that. So one of them that I applied for, I would not need my license until the second half of the residency program, which is when I'm going to be precepting on the floor, shadowing a nurse. So start applying for your residency program if you are interested into a residency program. If you are not interested into a residency program, still start applying into the specialty. Put your name out there, but make sure before you start applying for a job, especially if you're in the state of Florida, that you have a license number. Okay, and also if you are in the state of Florida, they might not even start looking at your application if you take your exam through the State Board of New York, because remember, your license is from New York and not Florida. Okay, so that's something that you need to start working on. Start with the process. The minute that you get your license number, start the process of transferring your license from Florida, from the State Board of New York to Florida. I will have a video that shows you the process on how to endorse your license from New York through the state of Florida if you're not interested in working or going to work in the state of New York. If you're interested in working in New York, okay, start applying in New York and stuff like that. But if you live in Florida and you're gonna work in Florida, then you're gonna need to endorse your license from New York to Florida, and I'm gonna have a video coming up. Check click on the notification so that way you can receive or see that video when I post it. Okay. Number 7, get yourself ready for the interview. Guys, this is not the regular. If you have a job before, you've been to interviews before, this is not the same type of interview. You need to get yourself ready for those interviews. If, for example, you are going to ICU, find out what are some diseases. I know in ICU you get a lot of diseases, but based on the hospital that you are going to, start doing your research to know about the hospital and to see what are the majority of the patients that they are receiving through their ICU. Based on that, you can see what type of diseases that you're going to be encountered the most in that hospital and brush up on those diseases. Because when you go to your nursing interview, you are going to get some medical questions. Okay, they might be asking you, the patient have sepsis, how would you attend to this patient? You walk in the room and you see your patient is bleeding, what would you do as a nurse? And you need to walk them through this process. There's a lot of YouTube videos out there that show you how to walk through a scenario. So do your research on the hospitals that you're applying for, that way you are well known or you know about the hospital if they ask you questions. Get yourself ready, go over, ask me about me question. That's not going to be, for example, I've been in retail most of my entire life and then I switched to aviation. If they ask me about myself in a nursing questions, I need to understand how to enter my nursing, although I did not have any experience, work experience in the nursing field, but I was able to incorporate some of my clinical experience and my customer service experience into that answer. That way I can show them that I am a well-rounded individual and I can deal with any type of patients basically. So do your research, get ready for interview. Do not just have the interview and just go. The recruiters most of the time gonna ask you, hey, I can schedule you for interview tomorrow. You can tell them, hey, can you push me a week later, or can you push me a couple of days later? That way you can be ready for that interview. Okay. Number 8, I think I mentioned it before, once you receive your license number, you can start with transferring your license from the state that you took the test to the state that you're going to be working to. For example, like I gave you guys an example earlier, I'm leaving Florida, but I take my test through the Board of Nursing. The minute that nurses.com posted my license number, I was able to get my license number and start transferring my license from New York to Florida. So make sure you start doing that process as early as possible, because it might take some time for you to get your Florida license. Okay, so make sure you are working on that. At number 9, go to your job interview dressed properly. Guys, I mean, you are now a professional, so dress like it, act like it. Okay, be confident, be ready, dress professional. If you're a woman, please do not wear scrubs, or men, do not wear scrub to your job interview, because this is not professional unless they tell you to. The dress attire is to wear scrub. Dress professional, and for women, wear shoes that are comfortable. Okay, wear shoes that are comfortable, because on that first interview, if they are interested in you, they might want to give you a walk around the floor, give you a walk around the hospital. So be comfortable, wear something, you can wear something flat, but something that is professional. Woman, make sure your hair pulls back, your makeup is extremely light, ease up on the jewelries and all those things. If you don't know how to dress for a nursing interview, I can do a video on that, but also Google, what to wear for a nursing interview, and you'll get a lot of stuff coming up. So get yourself ready for that interview. Last but not least, start shopping for your medical items that you're going to need. So if you do not have a stethoscope, for me, I've been out of school for 11 years, so I don't know where my old stethoscope was, my pen lights and all those things. So if you are like me, start shopping for your item, your stethoscope, your pen light, scissors, your nursing gears. That way you can have them once you get hired, or once you start your residency program, whichever way you're gonna go. That way you can have those items. All right, guys, if this information was informative to you, go ahead and share it with a friend that might be interested in this subject. And don't forget to subscribe, like, comment down below, and let me know your experience. Mind you, this video is not only for people that took their test from the from the Board of New York and they live in Florida. That can be applicable to anybody. So please use this video, and hopefully it helps. I'll see you on my next video. Bye bye.